As climate change accelerates, the communities we live in are increasingly exposed to rapid, extreme heat events that arrive with little warning but leave long-lasting consequences. The heat waves driven by rising atmospheric and ocean temperatures are no longer seasonal anomalies. They are becoming unpredictable emergencies that threaten lives, livelihoods, and the social fabric of entire neighborhoods. The human toll is immediate. Heat stroke, dehydration, cardiovascular strain, kidney failure, and respiratory distress surge in hospitals. But beyond the hospital walls, entire communities are struggling to cope with the cascading consequences: energy blackouts, water shortages, food insecurity, and the invisible psychological strain of repeated crises. Local readiness is emerging as a crucial line of defense, yet the stark reality is that many neighborhoods remain dangerously unprepared, with social and infrastructural vulnerabilities that magnify the risk of illness, mortality, and social disruption. Community-driven initiatives to mitigate these risks are often small, decentralized, and uneven, but they are critical lifelines. Heat shelters, for example, provide immediate relief to residents who lack air conditioning or access to cooler indoor spaces. In some urban neighborhoods, public libraries, community centers, or even repurposed schools are open during peak heat events, staffed with volunteers who provide hydration, basic first aid, and a safe place to rest. While these shelters save lives, their reach is often limited. Many vulnerable residents, particularly the elderly, people with mobility issues, or those living in informal settlements, cannot access them quickly. When temperatures climb into dangerous extremes, even short delays can be fatal. Without robust planning, these life-saving resources can become overcrowded, under-resourced, or inaccessible precisely when they are most needed. Neighbor-to-neighbor support networks represent another critical layer of resilience, though they too are fragile. Communities that actively check on elderly residents, children, and those with chronic illnesses during heat waves can reduce preventable deaths. These networks often function informally, relying on social cohesion, local trust, and voluntary participation. Yet in neighborhoods fractured by economic inequality, crime, or social isolation, these networks are weak or non-existent, leaving individuals dangerously exposed. Repeated heat waves exacerbate these disparities, as socially isolated individuals may suffer alone, unable to signal distress until medical intervention is too late. The warning is clear: social infrastructure is as critical as physical shelters in preventing mortality during rapid climate shocks. First aid readiness is another essential, but often overlooked, component. Rapid response to heat-related illness requires more than casual knowledge. It demands training in recognizing early signs of heat exhaustion, dehydration, and cardiovascular stress, as well as the ability to deliver prompt interventions like hydration, cooling, and monitoring vital signs until professional medical care can be accessed. In many communities, first aid capacity is insufficient, and volunteers or residents lack both equipment and training. As heat waves intensify, the number of people requiring assistance can overwhelm informal responders, leaving gaps that are literally life-threatening. Unlike storms or floods, heat is invisible until it has already inflicted harm, which increases the likelihood of delayed treatment and avoidable deaths. Local planning often confronts infrastructure limits that magnify climate risk. Power grids fail under surging demand for air conditioning, water pressure drops in critical systems, and transportation networks falter, making it difficult for residents to reach cooling centers or for emergency responders to reach those in need. Public spaces intended as shelters may lack functional air conditioning, sufficient hydration supplies, or shaded outdoor areas. Roads, sidewalks, and public transit can become lethal under extreme heat, especially for those commuting to work, attending school, or accessing healthcare. The human and material costs compound rapidly, revealing how vulnerable communities can experience cascading crises from a single ocean-driven heat pulse. Economic vulnerability intersects with these risks, creating a multiplier effect. Workers without the ability to take breaks or work from cooler environments are exposed for prolonged periods, increasing illness and absenteeism. Low-income households are less likely to own air conditioning, have reliable access to water, or possess vehicles to escape urban heat islands. Schools in underfunded districts may close preemptively, disrupting education while parents miss work, compounding financial stress. Heat events push already precarious households further toward poverty, malnutrition, and social instability. Communities with limited resources are therefore at the sharpest edge of climate impact, facing both immediate health emergencies and long-term social and economic consequences. The mental health dimension is another alarming aspect. Repeated exposure to extreme heat creates chronic stress, anxiety, and trauma, particularly among those who lose loved ones, endure repeated hospitalizations, or face the psychological burden of failing infrastructure. These emotional impacts often go unrecognized until crises escalate, yet they can undermine community cohesion and resilience, reducing the effectiveness of neighbor networks, volunteer programs, and local response initiatives. The slow erosion of social trust and collective efficacy can leave neighborhoods more vulnerable to subsequent climate shocks, creating a feedback loop where each event amplifies both physical and psychological risk. Even in communities taking proactive measures, the scale of ocean-driven climate shocks can exceed local preparedness. Sudden, unexpected marine heat events can trigger regional temperature spikes that local meteorological forecasts fail to predict with precision, leaving shelters underutilized until it is too late. Rapid heat onset shortens the response window, meaning that even the most well-intentioned community plans can fall short without integration into broader municipal and emergency services. The warning is stark. Isolated local action, while vital, cannot fully offset the systemic threats posed by ocean-driven climate change. Coordination with city planning, health systems, and early warning services is essential. Despite these challenges, examples of resilience demonstrate what is possible. Neighborhoods with organized volunteers, well-mapped cooling centers, first aid-trained residents, and communication networks show measurable reductions in heat-related mortality. Programs that combine public awareness campaigns with practical support, hydration stations, transport to shelters, and systematic wellness checks create a safety net that can prevent avoidable deaths. Yet the broader reality is sobering. Most communities remain underprepared for the magnitude and frequency of climate-driven heat events expected in the coming decades. Without systemic investment, social vulnerability, infrastructure deficits, and rising ocean-driven heat pulses will continue to produce preventable illness, social strain, and mortality. The takeaway is urgent. Rapid climate shocks are no longer hypothetical. They are a daily threat that intersects with human health, social cohesion, and economic stability. Community readiness, through heat shelters, neighbor support, and first aid, is essential, but insufficient on its own. The warning is clear. Without larger-scale integration of local action into municipal, regional, and national preparedness plans, each new heatwave risks overwhelming even the most resilient neighborhoods. Ocean-driven warming is creating a future where life-saving response must be faster, broader, and more coordinated than ever before, or communities will pay the price in human suffering that could have been prevented.